Doctors at Apollo Hospitals, Bengaluru, have achieved a major medical milestone by successfully performing a rare and highly complex robotic double valve replacement using the latest generation Vinci Xi Surgical System.
You might know, this is the fourth press conference we are doing in Bangalore since the last 30 days. The first two were about oncology, how we used technology, how we used the latest and greatest of all the advancements available to provide the highest levels of patient care. The previous one was the launch of heart-lung transplant unit at our hospital. And today we have come with something that is even better, which talks about the usage of robotic technology in advancing heart care even further. Now, what gives us great satisfaction about this particular event is that it is not just the launch of a unit, it's not just an availability of an infrastructure, it is the perfect magic that is created when great clinical skill meets with great technology that men have created. Now, how that has happened is thanks to the leading clinicians who are sitting on the dais, and along with them there is a large team that is working in the background who is making sure that day in and day out we are providing the best of care to all the patients who come seeking that from us.
This achievement places Apollo among the very few centers in India to execute this procedure in the modern era of advanced robotic cardiac surgery. The procedure was led by Dr. Sathyaki Nambala, renowned cardiac surgeon and chief of robotic cardiac surgery at Apollo Hospitals, Bengaluru. This landmark surgery marks a significant advancement in bringing complex multi-valve replacement into the domain of minimally invasive, robotic-assisted cardiac care in India.
Practically to maybe 70 or 80%. In the next 5 years, most of valve surgery is going to go the robotic way. You will not see open heart surgery for valves in the next 5 years. The way things are going. In the next 10 years, you will see that the majority of bypass operations are also done with a robot. It's already happening. The stage is already set. I am at the helm of whatever research is being happening. I'm going and seeing what is happening there. And we are also giving a lot of feedback to these companies. So I think it is going to drastically change the way we do heart surgery. In 10 years, you may not see many patients undergoing open surgery. Most of it is going to be robotic. What is going to come is also AI. I don't know how AI will play. The way it is going on now, I think in by 5 years, you are going to have AI there, and AI is going, as soon as you put the camera inside, AI will tell you, probably even before you put the camera, AI will tell you these are the places where you should put the camera when you sit at the console. That technology is already going to come. I've seen that technology in play, as an experiment, of course. So that technology is going to come.
Where did you see that, sir?
At Intuitive, since I sit on the board for Intuitive, a select few are taken to the US, and we are shown what technology is coming, and they ask for feedback.
It is the precision what we are talking about. When anything gets into human system, you want it to be next to God, in the sense it should not fail. It has to have the perfection close to the ideal. I think only in the recent past that our Prime Minister and the government is thinking at producing, manufacturing these precision equipments like microchips, programmable ones. See, this cannot afford to fail because it costs a life. So I think we are walking towards that high quality, reliable machine making, which is not a reality at this point in time.
What is robotic surgery? Basically, robotic surgery ಒಂದು ರೋಬೋಟ್ ಮೂಲಕ ಹಾರ್ಟ್ ಆಪರೇಷನ್ ಮಾಡ್ತೀವಿ. ರೋಬೋಟ್ ಹಾರ್ಟ್ ಆಪರೇಷನ್ ಮಾಡುತ್ತಾ ಇಲ್ಲ. ಈ ರೋಬೋಟ್ನ ಒಬ್ಬ ಮನುಷ್ಯ ಸಿಟ್ಟಿಂಗ್ ಬಿಹೈಂಡ್ ಅ ಕಾನ್ಸೋಲ್ ಕಂಟ್ರೋಲ್ ಮಾಡಿ ಮಾಡೋವಂಥದ್ದು. ಏನಿದರಲ್ಲಿ ರೋಬೋಟಿಕ್ ಸರ್ಜರಿಲಿ ನೀವು ಹಳೆ ಹಾರ್ಟ್ ಆಪರೇಷನ್ನಲ್ಲಿ ಈ ಎದೆ ಗೂಡನ್ನ ಕುಯ್ದುಬಿಟ್ಟು ಆಪರೇಷನ್ ಮಾಡ್ತಾಯಿದ್ವಿ. ಇವತ್ತಿನ ದಿವಸ ಆಮೇಲೆ ಮಿನಿಮಲ್ ಇನ್ವೇಸಿವ್ ಸರ್ಜರಿ ಅಂತ ಬಂತು. ಮಿನಿಮಲ್ ಇನ್ವೇಸಿವ್ ಸರ್ಜರಿ ಏನು ಮಾಡಿದ್ವಿ, ಒಂದು ಸಣ್ಣ ಇನ್ಸಿಷನ್ ಮೂಲಕ ಹಾರ್ಟ್ ಆಪರೇಷನ್ ಮಾಡಿದ್ವಿ. ಅಂದರೆ ಇನ್ಸೆಷನ್ ಒಂದು 2.5-3 ಇಂಚ್ ಇರ್ತಿತ್ತು. ಆ 3 ಇಂಚಿನಲ್ಲಿ ಒಂದು ರಿಟ್ರಾಕ್ಟರ್ ಹಾಕ್ಬಿಟ್ಟು ಈ ಪಕ್ಕೆಯಲ್ಲಿರೋ ರಿಬ್ಸ್ನ ಸ್ಪ್ರೆಡ್ ಔಟ್ ಮಾಡಿ ಹಾರ್ಟ್ ಆಪರೇಷನ್ ಮಾಡ್ತಾರೆ. ನೆಕ್ಸ್ಟ್ ಇವತ್ತು ರೊಬಾಟಿಕ್ ಆಪರೇಷನ್ ಮಾಡ್ತೀವಿ. ರೊಬಾಟಿಕ್ ಆಪರೇಷನಲ್ಲಿ ಅತಿ ಸಣ್ಣ ದ್ವಾರ ಅಂದರೆ ಇಟ್ಸ್ 0.8 ಸೆಂಟಿಮೀಟರ್ಸ್ ಆರ್ 8 ಮಿಲಿಮೀಟರ್ಸ್, ಇಷ್ಟು ಸಣ್ಣ ನಿಮ್ಮ ಬೆರಳ ತುದಿಯಷ್ಟು ಸ್ಮಾಲ್ ಹೋಲ್ನಲ್ಲಿ ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ಸ್ ಹಾಕ್ಬಿಟ್ಟು, ಈ ರೊಬಾಟಿಕ್ ಇನ್ಸ್ಟ್ರೂಮೆಂಟ್ಸ್ ಹಾಕ್ಬಿಟ್ಟು ಅದನ್ನು ಕಂಟ್ರೋಲ್ ಮಾಡಿ ಹಾರ್ಟ್ ಆಪರೇಷನ್ ಮಾಡಿ. ಏನಕ್ಕೆ ಈ ಥರ ಹಾರ್ಟ್ ಆಪರೇಷನ್ ಮಾಡಬೇಕು? ಅತಿ ಕಡಿಮೆ ಪೆಟ್ಟು ಆದರೆ ದೇಹಕ್ಕೆ ರಿಕವರಿ ಬಿಕಮ್ಸ್ ಫಾಸ್ಟರ್. ದಿ ಲೀಸ್ಟ್ ಅಮೌಂಟ್ ಆಫ್ ಟ್ರಾಮಾ ಇಸ್ ವಿತ್ robotic surgery. So with the small 8 millimeter instruments we go inside and then do the same operation that is done with hands through open surgery. That is the beauty of robotic surgery. So when we do that, because these holes are so small, there is very little pain. Because the holes are so small, there is very less bleeding. Because the holes are so small, there is very little infection. Because the holes are so small, the recovery is so much faster that patients can leave the ICU within 12 hours and probably go home within 48 hours. ಈ 48 ಅವರ್ಸು 12 ಅವರ್ಸು ಎಲ್ಲ ಪೇಷಂಟಿಗೂ ಡಸ್ ನಾಟ್ ಅಪ್ಲೈ. ಯಾಕಂದರೆ ಇಟ್ ಡಿಪೆಂಡ್ಸ್ ಅಪಾನ್ ದಿ ಪೇಷಂಟ್ಸ್ ಕಂಡೀಷನ್ ಆಲ್ಸೋ. ಸೊ ಪೇಷಂಟ್ ಹೆಲ್ತಿ ಇದ್ದು ಫಿಟ್ ಇದ್ದು ಹಾರ್ಟ್ ಆಪರೇಷನ್ಗೆ ಬಂದರೆ ವಿತಿನ್ 48 ಅವರ್ಸ್ ಪೇಷಂಟ್ ಕ್ಯಾನ್ ಆ್ಯಕ್ಚುಲಿ ಗೋ ಹೋಮ್. ವಿ ಹ್ಯಾವ್ ಸೆಂಟ್ 40-50% ಆಫ್ ಅವರ್ ಪೇಷಂಟ್ಸ್ ಗೋ ಹೋಮ್ ನೆಕ್ಸ್ಟ್ ಡೇ ಆಫ್ಟರ್ ಸರ್ಜರಿ. ದಿಸ್ ಇಸ್ ದಿ ಬ್ಯೂಟಿ ಅಬೌಟ್ ರೊಬಾಟಿಕ್ ಸರ್ಜರಿ. ಸ್ವಲ್ಪ ಕಾಸ್ಟ್ ಜಾಸ್ತಿ ಆಗುತ್ತೆ ಹೌದು, ಬಟ್ it has enormous benefit to patients. It also has enormous benefits to surgeons because surgeons can see very well. When we do heart surgery, the most important thing apart from the instrumentation is whether I can see well. ನನ್ನ ಕಣ್ಣಿಗೆ ಚೆನ್ನಾಗಿ ಕಾಣಿಸಲಿಲ್ಲ ಅಂದ್ರೆ ಚೆನ್ನಾಗಿರೋ ಆಪರೇಷನ್ ಮಾಡಲಿಕ್ಕೆ ಸಾಧ್ಯ ಇಲ್ಲ. So it is very important to see well. So with a robot, the camera is 3-dimensional. It gives me 10 times magnification. When it does that, you can see extremely well. Small specks of calcium can be seen, which means the heart operation can be done beautifully. Can we do all heart operations with robot? Almost all heart operations can be done. Can we do heart operations in children? Very small children, still not possible. They have to be of a certain size. But anybody over the age of about 8-10 years, they are suitable for robotic surgery.
What is the success rate?
The success rate again depends upon the kind of patients we choose. So very sick patients may not be suitable for robotic surgery, or very complicated, extremely complex. Heart valve replacement ಜೊತೆ bypass operation ಜೊತೆ ಎರಡೆರಡು ಜೊತೆ ಆಗಬೇಕು ಅಂದರೆ ಇದು robotic operation ಸಾಧ್ಯತೆ ಇಲ್ಲ as of today. But any bari valve operation possible to do robotic, double valve operation possible to do robotic, bypass operation possible to do robotic. So ಇವತ್ತಿನ ದಿವಸ ಈ ಮಟ್ಟಕ್ಕೆ ಬಂದಿದ್ದೀವಿ. Probably in the next 2-3 years you will see that it is further expanding.
Thank you, sir.